everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. Noting that many institutes missed the opportunity to submit their requests, the National Medical Commission has reactivated the online portal for applications by medical institutions seeking permission for the establishment of new medical colleges and intake increase of MBBS and PG medical seats, or rather starting new PG courses for the academic year 23-24. The deadline for the same is set till 23rd December 22. In response to the drug major Johnson & Johnson proposal to import and market Teclistamab sterile liquid in vial 30 mg per vial and 90 mg per vial, the Subject Export Committee, that is the SEC, functional under the Central Drug Standard Control Organization, has opined the firm to submit patients' characteristics along with transplant history, if any, treatment details and details of approval of the drug in EU and US for further deliberation. Dr. Sanjeev Gulati, the Executive Director, Nephrology and Kidney Transplant of Fortis Group of Hospitals, NCR, has recently been elected as the President of the Indian Society of Nephrology. He was appointed as the 52nd President of ISN at its annual conference in Pune. Expressing concern over delayed bond service postings, the Madras High Court has recently slammed the government for forcing super specialty and postgraduate doctors to be idle by withholding their educational certificates. The High Court bench, comprising Justice R. Subramanian, also took note of the fact that the State Health Department of Tamil Nadu is neither offering government jobs to doctors who need to fulfill 2-year bond service conditions after passing out of the government medical colleges, nor releasing their educational certificates. Therefore, these doctors are not even able to pursue higher education or get private jobs.
Patients with treatment-resistant depression have a 23% higher risk of death than other depressed patients. They also have twice as much outpatient care and spend 3 times the number of days in inpatient care. These are the findings of a new study published in JAMA Psychiatry by researchers from Karolinska Institute and elsewhere, who conclude that it is important to identify patients at risk of developing treatment-resistant depression. Depression is the leading cause of functional disability the world over. The most common treatments are antidepressants or psychotherapy. Many sufferers need care for months or years, but a significant share of patients never recover despite 2 well-implemented treatment attempts. They have what is commonly called treatment-resistant depression. Antibiotic resistance, when infection-causing bacteria evolve so they are no longer affected by typical antibiotics, is a global concern. New research at the University of Tokyo has mapped the evolution and process of natural selection of E.coli bacteria in the lab. These maps, called fitness landscapes, help us better understand the step-by-step development and characteristics of E.coli resistance to 8 different drugs, including antibiotics. Researchers hope their results and methods will be useful for predicting and controlling E.coli and other bacteria in the future. The researchers used a method called Adaptive Laboratory Evolution, or ALE, to replay the tape on the evolution of drug-resistant E. coli to 8 different drugs, including antibiotics. The method enabled the researchers to study the evolution of bacterial strains with specific observable characteristics called phenotypes in the lab. This helped them gain insight into what changes might occur to the bacteria during the long-term process of natural selection. The antiviral drug Nirmatrelvir plus ritonavir was granted emergency use authorization for treating COVID-19 in December 2021. In clinical trials, the antiviral was associated with an 88% reduction in hospitalization or death among high-risk unvaccinated individuals with COVID-19. However, little was known at the time about whether it could significantly benefit vaccinated individuals as well as individuals infected with novel variants of SARS-CoV-2 that were not dominant during the drug's clinical trials. By leveraging a large, well-validated COVID-19 data repository housed within their system, Mass General Brigham researchers confirmed that the drug is associated with a 44% reduction in hospitalization or death in a highly vaccinated population of adults over the age of 50. In a recent scientific study, a research group identified light therapy as a promising non-drug treatment option. Patients included in the study showed a measurable improvement after just 14 days of use. The study results were recently published in the Multiple Sclerosis Journal, Experimental, Translational and Clinical. For the first time, the research team relied not only on surveys but also on objective measurements when selecting the test persons. For example, sleep-wake disorders were ruled out in the 26 participating MS patients, particularly with the assistance of various sleep medicine examinations. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.